Today's February 12th, 2021, and I'm making this video because just earlier today, it came out that Andrew Cuomo, who's the governor of New York, his administration knowingly and intentionally undercounted deaths that took place in nursing homes due to COVID-19. Apparently, the Cuomo administration undercounted nursing home deaths by around 50%, meaning that there were 50% more deaths approximately that took place in nursing homes due to COVID-19 than what was being reported. Now, in the last few months on this channel, I've talked about how New York has done pretty well with COVID-19, especially when it comes to the daily death count. New York has done pretty well with COVID-19, especially compared to other states in the US. I've talked about how after the original first wave of the pandemic that took place in the spring in the United States, New York started doing a lot better with the virus. But in the first wave of the pandemic, New York handled it pretty badly. For a while, for a pretty long time, New York was number one in both total number of cases and total number of deaths, total COVID 19 cases and total COVID 19 deaths. Now, California and Texas both passed New York a while ago in terms of total number of COVID 19 cases, and I believe that Florida is also ahead of New York at this point in terms of the total number of COVID 19 cases that these states have had. But in terms of the total deaths, New York, up until just a few days ago, up until very recently, New York was number one in terms of the number of deaths that were caused by COVID 19. Just very recently, California surpassed New York and became number one in terms of the number of COVID 19 deaths that took place in that respective state. So, for almost this entire pandemic, New York has been leading out of every state in the United States. New York has been leading in terms of the number of COVID 19 deaths. And the vast majority of those deaths in New York took place during the first wave of this pandemic, which took place from around March to May of 2020. This was the first wave of the pandemic. Not that many states were actually affected that badly by this pandemic. The first wave of COVID 19 in the United States mostly affected states in the Northeast, such as New Jersey, Connecticut, and, worst of all, New York. In the first wave of COVID 19 in the United States, New York was by far easily the state that was most badly affected by COVID 19. You could see it in the daily case count and the daily death count. New York was easily leading in both of those metrics, and for a long time, like I said, New York was first place out of all the US states, both in terms of the total case count and the total death count. This brings us to the question of why was the death count so high in New York during the first wave? Now, there's many reasons for this. I mean, New York is pretty densely populated. There are a lot of people in a relatively small area, but one of the major reasons why New York suffered so badly during the first wave of this pandemic from March to May was because of their terrible nursing home policy during that time period. Like I said earlier, credit where credit's due. After the initial first wave of this pandemic, New York handled COVID 19 pretty well, especially compared to many other states in the United States. But during that first wave from March to May, New York did not at all handle COVID 19 well, and the data shows that that's the case. Back in the spring of last year, back in the spring of 2020, when this pandemic first began, New York, what they would often do back in the spring was a patient who recently got released from the hospital in the state of New York. What would often happen to these patients was that they would be sent to nursing homes. These patients would often get sent to nursing homes. Here's the thing though, even if these patients tested positive for COVID 19, they would still get sent to these nursing homes. I think it's pretty easy to see what could go wrong here. You have a patient testing positive for this virus, but they get sent to a nursing home. Who are the people that are mainly in nursing homes? People of old age, senior citizens. Which demographic gets most badly affected by COVID 19? Senior citizens, people of old age. So it's easy to see what went wrong here. You had a lot of deaths in these nursing homes because of the fact that COVID 19 spread pretty quickly through these nursing homes, because you had these patients who were recently released from the hospital getting sent to these nursing homes, but then the virus started spreading to other people who resided in the nursing homes, and because a lot of them were of old age, you had quite a lot of deaths taking place in these nursing homes throughout the spring of last year. This right there is a major reason why New York was by far the state with the most number of deaths per day throughout the spring of 2020. throughout that period of time during the first wave of this pandemic, New York by far had the most deaths per day, most COVID 19 deaths per day out of every state in the United States. Now, this nursing home policy where patients who, even if they tested positive for COVID 19, patients that recently got released from the hospital, then being sent to nursing homes, this was actually reversed sometime in late spring of 2020, sometime in, I think, May of 2020. It probably was May. I don't remember the exact date, but I'm pretty sure it was May of 2020, but late spring, early summer 2020, around that time frame. Basically, when the first wave was starting to finish up and we were starting to recover from the first wave, that's when this nursing home policy was reversed, and these patients no longer were sent to the nursing homes after this. So after that, that is when you really started to see a massive decrease in the daily death count in New York. That's when New York actually started doing well in terms of the number of deaths that they were getting due to COVID 19. But the damage had already been done. They had already had over 30,000 deaths in the state due to COVID 19, and a large number of those deaths were a result of the terrible nursing home policies. Like I said earlier, after this initial first wave of the pandemic back in the spring, New York started handling COVID 19 much better throughout the summer and even in the fall of 2020 and I guess winter of 2021. So, up until now, New York has been handling the COVID 19 pandemic relatively well, at least compared to many other states in this country. For the number of people that live in the state of New York, the number of deaths that they've gotten per day throughout the past 8 or so months, ever since the first wave of COVID 19 started to clear up, the number of deaths they've had per day is relatively low when you take into account the number of people that live in the state of New York, which is almost 20 million. But that now brings us to today, where we've just found out that the number of nursing home deaths, nursing home COVID 19 deaths, was in fact undercounted, and that there were actually 50% more COVID 19 deaths that took place in nursing homes than what was reported. So I just looked it up, and it turns out that Andrew Cuomo reversed the nursing home policy on May 10th, 2020. On this day, he announced a new policy where basically hospitals were not allowed to discharge a person who tested positive for COVID 19. They were not allowed to be sent to a nursing home. So this was passed on May 10th, and that is why I think that is a major reason why the number of deaths per day due to COVID 19 in the state of New York started to decrease pretty rapidly after this policy was passed. But the damage, like I said, the damage had already been done. You already had tens of thousands of deaths that took place in the state of New York due to COVID 19, and a decent number of those deaths took place in nursing homes. So at this point, the Cuomo administration, Andrew Cuomo, but also one of his aides named Melissa DeRosa, they are under a lot of scrutiny right now because of what's going on with the nursing home numbers and how they were undercounted. And it's easy to see why a lot of people are pretty angry at the Cuomo administration right now. In my opinion, what the Cuomo administration really needs to do right now is just own up to the fact that they made a mistake. They made a mistake undercounting the number of nursing home COVID deaths. They also need to own up to the fact that the way they handled these nursing homes in the first place back in the spring was not good at all. I know that Andrew Cuomo reversed the policy in May of 2020, reversed the nursing home policy, and he made it so that patients who tested positive for COVID 19 no longer could be sent to these nursing homes. But he never really apologized, or he never really owned up to the fact that he had made a mistake in the first place with how he was handling these nursing homes and how he was allowing these COVID 19 patients, these patients who tested positive for COVID 19, he essentially allowed for these patients to be sent to the nursing homes after they were released from the hospital. I think that if he owned up to undercounting the number of nursing home COVID 19 deaths and also owning up to the fact that he made a mistake by allowing COVID 19 patients to be sent to these nursing homes, I think if he owned up to both of those, admitting that he made a mistake with both of these things, then I think he would receive less scrutiny. Obviously, those are still bad things. He shouldn't have done either of those things, but I think if he just owned up to it and made it clear that he regretted what he did, I think that he would really receive less scrutiny for what he did. I think that the Cuomo administration made a terrible mistake with undercounting the number of nursing home deaths, the number of COVID 19 deaths that took place in nursing homes. Not only is that the morally wrong thing to do, not only is that morally incorrect to just lie about the number of deaths that took place in these nursing homes, it also makes the administration look really bad. Sure, at the time, if the Cuomo administration had told the truth about how many nursing home deaths there really were, it would have made them look worse at the time, the fact that there were that many nursing home deaths, but in the long run, it would have been a lot better for them because now we know that not only were there that many nursing home deaths, not only were there that many COVID-19 deaths that took place in these nursing homes, the Cuomo administration also tried to cover it up, which I think is pretty egregious. The fact that they tried covering it up, not only did they allow these deaths to happen, they also tried covering it up, which I don't think is good at all. I think that that's pretty egregious what they did and how they messed up in that aspect. And I really think that Andrew Cuomo and his administration just needs to own up to the fact that they screwed up. But until the Cuomo administration owns up to what they did and how they messed up, a lot of people are not going to have an easy time forgiving the Cuomo administration for what they did. Even after he owns up to making a mistake, I think that a lot of people will still have a hard time forgiving him, but it'll be easier on a lot of people if at least his administration and he himself owns up to the fact that they screwed up, they made a mistake with the nursing homes, they made a mistake undercounting the deaths that took place in these nursing homes. But I think that if he just comes clean, that will be a lot better for the Cuomo administration in the long run.